Hello, I'm Dr. Danny Y, and I'm bringing to you another episode of 5-Minute Diabetes. So today I'm going to talk about treatment for diabetes. In a previous episode, I've explained how bad diabetes control can cause complications and different kind of complications. So is there any hope? Are we doomed to develop the complications? Of course not, of course not. With good diabetes control, you can prevent almost all of the complications. Okay, so how do we, bring about that? We're all, excited when we are diagnosed with diabetes. The whole world, crashes down. Well, there are actually many things that you can do. First, the exercise. It is well known that exercise would help with diabetes control. And in the first place, a sedentary lifestyle, lack of exercise is the cause of diabetes. So once you have diabetes, no problem, go start running already. I always tell my patients, after seeing me, I give you MC and go for a run, go to the gym. You can do whatever you want, swimming, badminton, basketball, you name it, golf, any exercise, jogging, lifting weights, they're all good. Any exercise would help with diabetes because it helps use the muscles, use the energy, build the muscles, and the muscles build up will also in turn decrease the resistance to insulin, help with the diabetes control. Second is the diet. I'll elaborate about the diet in a later program, but for now it's suffice to say that you should try to limit the total amount of carbohydrates, especially is sugar, simple sugar, and the other one is the refined carbohydrates. So simple sugars are things like sugar, juices. So rather than drinking coffee, you can consider coffee C croissant. Rather than drinking bubble tea with pearls, you can consider drinking bubble tea with zero sugar and no pearls. So, sorry. Bubble tea without sugar and no pearls may not be called bubble tea anymore, but you get the drift. Limit the sugar. The other thing that is very important is the refined carbohydrates. So refined carbohydrates are things like white rice, white bread, potato chips, popcorn, sweet corn. So why are those things so bad? Well, generally because the refined carbohydrates, they do not have any husks. So all the fibers has been removed. We talk about the jasmine rice, it's a glistening rice which is very easy to digest when we eat it. The problem is that after the digestion is very quick, and then the blood sugar starts to rise. The rice becomes sugar, and then the sugar drives the blood sugar. So for diet-wise, suffice to say that we must control the simple sugars and the refined carbohydrates, and that's why take more complex carbohydrates. Don't add any simple sugars into your drinks. Then there's medication. Now, each of us are different. There are many different reasons for diabetes. For some people it's the gene more important, for some people it's the obesity that's more important, for some people it's the lifestyle that's more important, and they all have slightly different ways of the diabetes process, and that's why your doctor will need to assess you to decide which is the best type of medication. Now, however, a lot of my patients believe that the medication would kill their kidneys or liver. That is very serious. To which I must say that is not possible. It's like saying that if medical students go and study and then they take the exam and then fail, then the studying is the reason that they failed the exam. Now, of course not, right? All of us know that even how smart medical students are, medical students need to study in order to pass the exam. So for diabetes, it's the same thing. Diabetes is the reason for the complications. Say kidney failure, blindness, and then nerve problem, amputation. And for the badly controlled diabetes have high risk of these complications. And the better the control is, the lower the risk, the chance of developing these complications. So as some people will still get no matter what they do, but those are very rare. Generally, it's the people who do not control the diabetes well who gets the complications. So the medication is not the cause. Although most patients with diabetes will actually take medication. Now, just because some of them would develop the condition does not mean that the medication is the cause of that. Just because medical students study and then some of them fail the exam doesn't mean that the studying causes the exam. In fact, the studying prevents the failing. So the diabetes medication is the same thing. For patients who take the diabetes medication, the risk of, say, kidney failure, amputation is much lower because the diabetes is much better controlled. So it's actually contrary to what we believe or what we've been told. Diabetes medication definitely is useful, and your doctor will never give you something that is going to harm you. Look, if we know that the medication is going to kill your kidneys and I still give you, what kind of doctor that makes me? So of course we would never do that. And the Ministry of Health will also never do that. So thank you, and this is Dr. Danny Y, and I'll see you again in the next episode.